In a world where truth is often sacrificed at the altar of profit, one disease continues to devastate families across America: cancer. This ruthless killer has been labeled incurable by mainstream medicine for decades. But are we being told the whole story? Welcome to GoldCare Townhall, where we dare to ask the questions others won't. Tonight, we dive deep into what truly causes the cancer epidemic sweeping our nation. We'll explore whether toxic chemotherapy and invasive surgeries are truly the only options available to patients. Most controversially, we'll examine the evidence suggesting effective treatments may exist, but remain suppressed from public knowledge. This groundbreaking town hall, moderated by the fearless Dr. Simone Gold, brings together John Richardson Jr., founder of Richardson Nutritional Center, and Dr. Jonathan Murphy, integrative oncologist and holistic health advocate. This town hall is proudly sponsored by GoldCare, the platform built on the foundation that medical freedom is non-negotiable. GoldCare, built for you, powered by freedom, trusted by thousands.
Welcome to GoldCare Medical Townhall, and thank you so much for being here. We have an amazing discussion lined up for you this evening. Joining us tonight is Rick Hill, author and 50-year cancer survivor who overcame stage 3 embryonal cell carcinoma without chemotherapy or radiation. He works with our good friends at Richardson Nutritional Center. We also have Dr. Jonathan Murphy, an expert in integrative oncology with a background in emergency, critical care, pediatric, and gynecological medicine. He leads AZ Good Health Center. Our moderator is Dr. Simone Gold, founder and CEO of GoldCare. Tonight, we'll discuss what is likely the biggest disease topic in healthcare: cancer. Few words strike as much fear. Often fatal and long considered incurable, it has marked the lives of countless millions with pain, loss, and suffering. But are we being told the truth about cancer? Why is it such a widespread problem, and can it ever be cured? These questions are often considered forbidden and unspeakable, which is precisely why we're asking them tonight. But before we do that, consider this. There's a link you can click right now in the title of tonight's live stream. It's goldcare.com/drgold. This link is your instant access to GoldCare right now at no cost to you with no obligation. Click it and sign up right now in about 30 seconds, and Dr. Gold will take care of your first month of membership. You can freely cancel at any time, but we're pretty sure you'll agree GoldCare is a must-have membership. When you arm yourself with the facts, you're protected against propaganda and confusing news reports that keep you up at night, worried about your kids and your family. Becoming a GoldCare member is a key first step to reclaiming your freedom and control of your health so you can push back against medical tyranny. Please click to retweet and share this important live stream, and then click that link to visit goldcare.com/drgold and get your first month on us. Think of it like Netflix or Amazon Prime. But instead of a woke movie or free shipping, you're getting the gold standard educational subscription for all of your healthcare needs and access to doctors you can actually trust. Now it's my pleasure to introduce our moderator, Dr. Simone Gold.
Good evening, everybody. I am delighted to do our medical town hall every month, and tonight's topic is surely one that captures the interest of everybody. As everybody knows, I am residency trained in emergency medicine, and I worked in ERs for 25 years. And I did not have special training with cancer patients, but I did notice year after year kind of the almost bizarre way in which oncologists were treating cancer patients. I really don't speak about this so much publicly because we have a lot of things to talk about in general, but it was clear to me that chemotherapy was being offered far too aggressively, far too often. It's a long story, but I'm saying all this because I've been curious for a long time about cancer, but I didn't put my attention to it. Then COVID came, and I saw so much dishonesty in my beloved profession that it caused me to look at everything with new eyes. Certainly one of those is cancer. Of course, we all heard, and I've been educated for probably 4 years now, about the benefits of ivermectin and fenbendazole and repurposed medications. This also piqued my interest. So I'm delighted to sit tonight with two people who know much more about the subject than I do. That is one of the purposes of the town halls, is to bring in other experts, other perspectives, other points of views. So we will start with, I think we're starting with Dr. Murphy tonight. We also were supposed to have Dr. Richardson tonight. He was unable to make it, and we send our best regards to John Richardson. Excuse me, I do that. And we are so grateful that Rick Hill, also well known with John Richardson, was able to join us tonight. His story is absolutely fascinating. So COVID taught us that you have to have a person that you can trust to turn to if you get a serious diagnosis, right? What does it mean? Where to go? What to do, etc. So my first question really is, what causes cancer? Now, we put this subject out, and people pointed out, of course, that cancer is not one disease. Yes, of course, I know that. But we're just talking globally. Like, what causes cancer? I think it should have been a clue to us doctors that it wasn't just one disease or one treatment, given that they all act so differently, and that perhaps our whole theory about cancer is wrong. So we're going to start with what causes cancer anyway. And for that, I'd like to turn to our first guest, Dr. Murphy. Thank you.
Good question. And yeah, COVID has brought out so much of the cancer that, so what does cause cancer? I'm a believer that there's three big pictures. One is unknown or unidentified toxins, usually unidentified. So toxins are part of that. The biggest one I think that's missed is nutritional deficiencies, because our immune system is fully capable of taking, especially early, a surveillance and control of cancer right in the 1, 2, 4, 8, 16 cell stages. The third thing that seems to cause cancer, I think this is better known, is stealth microbes, or sometimes well-known microbes, such as the HPV with cervical cancer. So I think those three things, and with nutritional deficiencies leading to immune system insufficiencies. That's how I look at it. So
we've certainly seen that a lot, and this is also something I really picked up on the last few years. I was good friends with Dr. Ryan Cole since the beginning, and he was seeing the on the pathology. So he's a pathologist. He was seeing how badly the shots were hurting people's immune systems, and I think he was the first person who said to me the concept of turbo cancer. And really, the facts are that it's very obvious that if you harm your immune system, the incidence of cancer goes up. So certainly, I agree with you on that. If your immune system is stressed, your body is not able to suppress the mutations that are going on in our bodies all the time. So anything else you might want to share about that, like the interplay between the vaccines?
Oh, yeah. Yeah, definitely. What has happened following the introduction of the mRNA COVID vaccine was that the body was producing a toxin of its own, an inflammatory thing called spike protein. And spike protein not only is inflammatory, but it also seems to shut off two major cancer suppression pathways. So the spike protein is not something I would introduce into a cancer patient, especially because I've seen people who had cancer reach remission, get the mRNA vaccine, and it took off without any ability to control it. And this is not something I've seen. 25 years I've been doing this, and this shot and the spike protein really caused things to go wrong. And yeah. It's the immune system that it caused to go wrong, the cancer surveillance system.
I want to emphasize that and endorse that as well. I saw many examples of that. The people who had cancer in the past, it was in remission and came back with a vengeance. There was actually a case report that a doctor had done on himself. He had taken the COVID shot. He wasn't a prior cancer patient, but he took the COVID shots, and then he developed very rapid aggressive cancer. And it was either within days or a couple of weeks of taking the shot. And within the article itself, he wanted to distance himself from being called a conspiracy theorist. And within the article itself, even though we pointed out how the cancer was kind of raging all over his body, he was like, well, but I don't think it's from the shot. It was kind of interesting. Basically, we know that the spike protein, for many different reasons, can suppress the body's immune surveillance system. And we certainly have seen the incidence of cancers rise and the aggressiveness. There are many oncologists who've spoken out that they're seeing cancers in younger ages than they'd ever seen in their entire careers. So you've seen that as well.
Yes, and the booster, which was the one that I'm not sure why, but it seemed to be the most clearly, people had some side effects, some fatigue for a few days, but after the booster, people were getting, and especially people who I later found recurrence of cancer in, they would take the booster and be in bed for a week or more, barely able to function with fatigue. And that seems to be, I believe the immune system, when you probably noticed it too, that when the white blood cell count is low, leukopenia, neutropenia, that there is usually a fatigue associated with it. I'm not sure with the booster, but I do know that in cases where people had been 10, 15 years in remission, having successfully taken care of their cancer years ago, decades ago, they got that booster, they had fatigue, and it came back with a vengeance. In fact, innumerable metastasis in someone who 6 weeks prior had no evidence of any cancer.
Thank you so much, Dr. Murphy. So this is a great point where we can introduce Rick Hill, because you are a long-term cancer survivor. So you probably have been watching these things for years, and I'm sure been very careful. So share with the audience your story, and then kind of your perspective on really where cancer came from, what the doctors told you, how you handled it.
My story began in 1974. I looked a little different back then. I guess I could show your audience. And yes, ladies, I do know that I had more hair. Thank you very much. And it was black. But I was a principal of a Christian day school back then. Just had graduated, just got married, had all the boxes checked. And then I think God has a sense of humor, don't you? I'm looking back at my life and I think, okay, you got me. But there I was. And I wound up at the Mayo Clinic in Rochester. And they immediately did some testing. And he said, we've got to do exploratory surgery. Now, Lewis and Clark didn't do any more than they did. I mean, it was nearly an autopsy. It lasted 8.5 hours. And when they got done, the chemotherapist comes by the room, sits on the edge of the bed and says, well, you do have cancer. And it is widespread. In fact, it is in your lymph system. That's like a super highway, fast, all over. He said, we operated on your neck right here, and we operated on the top of your feet, a lymphangiogram. And he said, you had cancer in both places. I don't know about you, but that's about all the real estate any of us have. And I have a scar 16 inches long to testify. So when that was all done, the chemotherapist said, today's Friday, we're going to start Monday to give you actinomycin D, which is not battery acid, but it's in that category. And so I don't know. I'm not a doctor. I went, yes, doctor. I don't know what's going on. But that night, I don't know if you have faith or a higher power or whatever drives you. But that night, the story got interesting because a pastor sent me a letter. I wasn't home to get it. I was at the Mayo Clinic, but a friend of mine got the letter, a 13-cent stamp, to show you how long ago this was, 1974. And the letter said this: Dear Rick, you're going to have to leave the Mayo Clinic in order to live. Signed, John Ballantyne. So I knew the guy. I called him up. I said, do you know where I am? He said, yes, Rick, I know where you are. I said, isn't this a citadel of modern medicine? He said, yeah, I think it probably is. Well, why would you want me to leave here? He said, because I don't think it's medicine you need at this point. What I think is you've got to go somewhere where they understand the immune system. And I'm not seeing that there. I said, oh, brilliant. So where do you think I ought to go? He said, are you sitting down? Never a good question. It's sort of a sphincter tightening moment. I said, yeah, John, I'm sitting down. He says, well, you fly into San Diego. And I said, oh, I'm thinking, who doesn't like San Diego? And I said, then what? And he said, you get on a bus and you go to Tijuana. Leave the Mayo Clinic. Go to Tijuana in the 70s. I'd been there. I'm not sure. Go ahead.
So, Rick, just in the interest of time, so what we call the medical industrial complex suggested after the massive surgery, chemotherapy, and you had an acquaintance, a colleague, who suggested that instead you build up your immune system. So that's obviously the path that you chose. And then what did that look like? Like, how did that change your life as a practical matter? What did you do to build up your
immune? I was there 21 days, and that's what trips people up because it's not that complex. And they gave me 3-gram injections of vitamin B17 daily, Monday through Friday, with a 6-gram injection every Saturday. I point that out because so many people come up and they say, well, that stuff is poison. And I say, well, how much do you think it would take to poison me? They'll tell me what they think. And I say, well, I took 6 grams daily for a while, intravenously. So I didn't die. In fact, I not only didn't get sick, my hair didn't come out, I didn't get sores, I didn't throw up, nothing.
So after that experience, did you see, did the doctor see a physical improvement in your cancer?
Yeah, absolutely. My color came back. B17 has a natural painkiller in it. And I was on morphine when I was at the Mayo Clinic. So when I got there, I was one hurting puppy. And in 2 weeks, my pain level had dropped 60-70%. And I felt better and my appetite started coming back. And I just thought, boy, I have taken the right decision here.
So based upon your experience, I assume you were then careful, as you proceeded in your life, to be very focused and careful about your general health. And that was your approach?
Well, that's right. Because what Dr. Contreras said to me, he said, I need an ally. This is participatory medicine. I can't do it without you. And I said, what does that entail? He said, your diet, first of all, 80% raw, uncooked, fruits and vegetable salads. And he said, and then you've got to detox. And that involves some mild fasting, colonics. There's a day at the beach. But I wanted to live. And I said that I would do everything they told me to do, especially because my church paid my way.
So this is very fascinating. So one of the things we emphasize heavily in GoldCare is the total body approach, the wellness approach. And this is something that I noticed in my career in emergency medicine, people just didn't do. I mean, somebody would have a cancer diagnosis and then they'd right away ship them off to a surgeon and the oncologist for chemotherapy, radiation. So your approach was entirely different. And here you are many, 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 many years later. So I just want to point out that I'm not saying Rick's experience is universal. I'm not saying it's not universal. I'm saying the approach is entirely different than the approach of the medical industrial complex. And here we have testimony showing something entirely different based on nutritional support, immune support, healthy living, watching your diet. I'm sure exercise is a part of it, all of those good things. So that's what we focus on also here at GoldCare. Drew, back at you.
Thank you, Dr. Gold. Yeah, what a great conversation. And the beauty of all of that is that at GoldCare, we emphasize this through education so that our members are educated to go and make the best decisions for themselves. And don't forget, there's a link you can click right in the title of tonight's live stream, right on your screen. It's goldcare.com/Dr. Gold. It's your instant access to GoldCare, no cost to you, no obligation. Just click it, sign up, and Dr. Gold will take care of your first month. Please also retweet this and share this live stream because this information is so great and so powerful, and we're just scratching the surface. Back to you, Dr. Gold.
People people often ask me what exactly GoldCare is. They're trying to put it in their head, like, is this, medical doctors? Are they naturopathic doctors? Is it whatever? So what we are essentially is we're education, and we are, and we provide access to independent physicians who are not bought and paid for by any interest other than, serving the patient, the doctor-patient relationship. But of the two, really, in fact, education is the bigger part of it. We want people to be well educated. I love that Rick just said that the person who was helping him out when he was much younger said, "I need an equal partner." Those are words like speaks to me, because that's what we want. Nobody is more invested in your health than you, and you should not be left out of that equation. You should be harnessed, and all your energy. Rick was highly motivated because he wanted to live. It was like that simple. So why not harness that energy? We're not top down. We're here as advisors, but we think much of that advice can come in the form of education. And then when you do need a physician, we have those as well. That's what we are exactly. So I just want to go right back to the cancer. And I have a couple questions for Dr. Murphy, because we just heard, Rick's story. And obviously there he was, he got all the surgery and they wanted to do chemotherapy. And then he walked away at that point. But in your experience, in my experience as an ER doctor, everyone had chemotherapy. I mean, everybody who had cancer diagnosis, it was almost embarrassing. Like if you didn't, in retrospect, I think there was a lot of social pressure around doing it. In your experience, is chemotherapy, surgery unavoidable? Is it avoidable? Like, what are your thoughts?
Well, I think that there are times when surgery may be essential. And in order to get into the conventional medical system, you have to have a tissue sample for the pathologist to tell you what you're looking at. However, is chemotherapy avoidable or essential? I think that chemotherapy is actually one step forward, two steps back in most cases. I would say that with statistically speaking, that with Hodgkin's lymphoma and testicular, there are some reasons to think chemo can be beneficial, but for 99% of all cancers, that's not the case. I think that one of the problems with chemotherapy is it doesn't kill the cancer stem cells, and it only kills the ones that are susceptible. So what that results in is a more aggressive cancer, if any is left behind, which it usually, most always is, afterwards. It's been made more aggressive by the treatment that removed the less aggressive cells.
So one of the things I want to point out is that GoldCare healers, GoldCare doctors and providers, it's never one size fits all. It really is your situation. So if you heard what Dr. Murphy just said, he particularly pulled out Hodgkin's, testicular cancer. Just like all vaccines are not the same, all cancers are not the same. They're different. They're different. So we want to fit the solution to the patient and to the disease process that's going on. That's super important. Do you have an opinion on, because this has lately been something on my mind, there's always been a lot of conflict in my mind about mammograms and things like that. And then I sort of expanded into biopsies. And do you have an opinion on, people being overdiagnosed, for example, on things like mammograms or even biopsies? Is that something that you've paid attention to?
Yeah, in fact, a lot of lumps are because of fear right away, immediately biopsied. And oftentimes this creates a whole mental situation where people are, do I have cancer? They biopsied, they called me in for a biopsy. So it becomes a greater generation of fear right there. And in fact, there's a big thing with mammograms that they do not save lives or extend lives in women prior to menopause. There are some studies, in fact, that postmenopausal women will have an earlier detection and may have a few months of increased life expectancy. But overall, I think over-diagnosing and over-fear-mongering with mammograms can be a big deal. Whereas if you have a good healthcare provider like we have at GoldCare, I think that getting a chance to talk to a doctor, finding out the options of assessment and diagnosis before you just jump right into multiple views on mammograms, which are radiation, so they are to some extent able to cause cancer. And then second of all, the whole biopsy thing, everything benign gets biopsied as well as everything malignant. I know that's a difficult call, but it does create great fear and then a scar there where in the future there may be issues come up. So I do have a lot of feelings. It would take longer than this talk to
right. So Rick, you have such an interesting story because you kind of walked away from the traditional medical advice and then you went on this other path. How have you I'm really curious how you navigated that over the next decades. Like, did you wipe your hands of physicians? Did you embrace them sometimes? Did you just become a super educated consumer and use them when it made sense to you? How did you navigate that?
I go to doctors, regular MDs today. I'm not Superman. I get the flu. I did not get the COVID shot. I did call a couple doctors, and the one of them said, "Will you lose your job if you take this?" And I said, "Yeah." He said, "Okay, I'd rather have you sell pencils on the corner than take that shot." And I said, "Message delivered. You got it." But look at some of the advances. Look at if I get run over by a truck, I'm not going to reach for a vitamin.
Right.
At that point, I need somebody to put me back together. And I wish, I'm so glad Bobby's here. I'm not going to get political on you, but couldn't he sort of bridge the two worlds if he worked at it so that it isn't us and them?
Correct.
Yeah, I think that everybody would do better if people in Western medicine would reach out to the homeopaths and they would. Yeah.
So actually, I think people portray other people as being more divisive. For sure, I believe in both. I mean, I'm classically trained as a modern American medical physician, and at GoldCare we have lots of medical doctors, and we have lots of naturopathic doctors. I've learned a lot from naturopathic doctors, but of course, trauma, orthopedics, neurosurgery, there are a lot of reasons to see a medical doctor. For sure, there's diseases that you have to see medical doctors, and then there's a lot of issues that humans have that maybe have become over medicalized, that we kind of put through, and we say that they're medical conditions when really this is just kind of life. And maybe you shouldn't be put through like the medical industrial complex. I do call it the medical industrial complex because there's a lot of incentives there. Have you been careful over the years in terms of watching like your diet, your weight, exercise? Is that something, because you had this early experience, is that something that you paid a lot of attention to?
Yeah, that was to my advantage. At first I felt like I was being picked on, but because I was so young when all this happened, I dedicated myself to 5 years, Dr. Gold, to eat the 80% raw and fast and do colonics. I fasted 3 days a week for 5 years. I don't expect everybody's going to want to do that, but I owed it to those people who paid my way. And after the 5 years, go ahead.
No, sorry. I'm saying it's very, very interesting and you were very motivated and compliant.
Yeah. And after that, I modified my diet to be a little more relaxed, but I never went back to my mother's fried chicken, everything fried. And I never went back to Coca-Cola and all of those things that I was really probably halfway addicted to. And I got better and better and better. And I did not see the people like me who went into Western medicine first. I just continued to get better. I weigh 160 pounds. I'm not taking any drugs, prescription drugs at all. And boy, good for me.
Yes. So the average, most people I saw in the ER who were over 50 were taking about 4 prescription drugs, which I remarked on at the time. I thought was unbelievable that is our society. So Dr. Murphy, you kind of flipped around a bit in the sense that you were classically trained, kind of like I was, but then you've switched more into functional, integrative, et cetera. What propelled that and thoughts on that?
Well, a number of things. I attended the 1999 American Holistic Medical Association meeting in George Washington University in Washington, D.C. And I experienced something there that I hadn't experienced at other medical meetings, CME events, and that is doctors hugging one another. It wasn't just a little limp, handshake like we always gave it at all the AMA meetings. No, this was actually people who were genuine and interested and honest. and not making a facade of, oh, I am so and so. This was real medicine. And also around the same time, a friend of mine who had failed conventional treatment for a very early cancer had changed her diet, and her life and health came back to her. She's still alive and well today. But she had failed everything, chemo, surgery, radiation, more chemo. So she changed diet after they told her you got 6 months to live. And she began detoxing, as Rick said, some colonic, some lymphatic massages. And, she just continued to get healthier and healthier, instead of what you and I saw in the ER when cancer patients came in. They would just get more sores, more, neutropenia, more sick. They were always that way with convention-based chemotherapy.
So it's just so incredibly interesting. So we really just want to help people. And I think we've observed, those of us who were, Dr. Murphy, like you and me, who were really in the trenches, like seeing patients on the front lines, we were noticing things that were, for example, all the cancer patients we saw that were not getting better, were just critically ill and just doing terribly. But we were not even at least I was not putting together that they were on the wrong path. Like they were just completely on the wrong path. And then it really kind of took COVID. I mean, I guess I saw it before, but I didn't really know about the alternatives. So now that I'm on the other side, I see metabolic syndrome, metabolic disease as kind of a pretty big root of much disease, which is essentially just, eating poorly and being a bit overweight, which is ubiquitous in America. And it's very difficult to be in normal body weight. But these are the kinds of things that doctors are not talking about, but they're contributing to people being very, very sick. So if somebody came to you, Dr. Murphy, with they said, oh, so-and-so told me I have X cancer, breast cancer, lung, whatever. What would you suggest their first step should be?
Well, I would actually talk with them about how I have for 25 years been helping patients heal themselves. So looking at it like that, and oftentimes they've been given the word, there's no cure for what you have, but there's something else, and that is the innate capabilities of healing. And so I would give them and help to reverse their fear would probably be the first thing. Letting them know that whatever you've been told doesn't need to create fear. And it's not true that what you've been told is the experience of those physicians using their treatments. And in fact, they are exactly right about that, but you're wise enough to choose a different path. And so I would work with them. The very first thing, and I think this makes perfect sense, I'll just say it, do things to limit or prevent metastatic spread. That should be number one in everybody's book, I believe.
Can you give some examples?
Well, yeah, there's from the rosemary bush, there's ursolic acid and rosmarinic acid, both of which have been shown to diminish the capability of cancer stem cells to achieve implantation and vascularization. The B17 that Rick called vitamin B17, the National Academy of Sciences ruled it's an accessory nutrient, not an essential nutrient. So we don't call it vitamin B17 here. We just call it B17 instead because of the National Academy of Sciences ruling. But it was in our diet for a long time. So that's the next thing I typically do is get them involved in getting these nutrients that have been systematically removed from our diet for the last 60 years. The one thing that they showed at Sloan Kettering was that it 90% effective in stopping guinea pigs who had breast cancer implanted in their abdomen from having any metastasis compared to the ones who didn't have the B17 rich diet. So that it's been shown in animals and in people that it's highly antimetastatic when you combine it with the rosemary bush. And then the third thing that I oftentimes work with is, these are is the pectin from citrus fruit, the white pulp that's around the peel, in a modified way so it can be absorbed. It becomes instead of stuck together, it becomes its own monomers or its own individual units that can be absorbed. And actually that binds to a receptor that all cancer cells have on them called galectin-3. And the modified citrus pectin is able to bind it in the circulation, wherever it is, lymphatic circulation or vascularity.
So I let you go on because I think it's so interesting for people to hear this, like that there's options, there's things to discuss, there's plans and treatments, and it's got to be individualized, and there's more options than you're being told. You actually just shared some things that I only know, very little about. That's why we have all different doctors at GoldCare, because it's a vast field, right? Understanding the human body and how to reverse different things. So you just got a little taste. Everyone who's listening, you just got a little taste of, just some options, but it depends on your situation. And, you have to sit down with a healer, somebody who actually wants you to heal, wants you to get well. That's really, really important. And back to Rick's point that he wishes it wasn't one or the other. It's definitely not one or the other. I believe GoldCare is the only place that we put medical doctors and naturopathic doctors on absolutely equal footing, because we work together very smoothly. We love our naturopaths love our medical doctors. The patients often will go back and forth depending on what situation they have. Some problems are better treated by naturopaths, and some situations are better treated by medical doctors, but we work absolutely collaboratively. So for me, that is what's very exciting about conversations like tonight, is that you have an example of a person who started in the traditional, but really by God's hand, and ended up in a whole different path, and is here to talk about it 50 years later to give testimony on that. And then another doctor who traditionally trained, who's here to tell you that there's a lot of things that you probably haven't heard about. And most importantly, as we learned during the COVID years, not to let fear hijack your ability to respond. The fear we saw during COVID, right? The fear caused people to make irrational decisions. That same fear can hijack your limbic system if you hear the word cancer. And we're here to tell you, don't live in that place, that it's not necessary, it's not accurate, and you just need more information, more people, and you have to be an active participant in helping your body heal. So we have all of that here at GoldCare, which is people who will listen to you and all the educational classes that we can support you with and teach you all those good things. Drew, did I miss that I was supposed to go back to you?
Thank you, Dr. Gold.
I'm so sorry.
Now it's just fine. So the conversation has been great so far, and I just wanted to point out a few things that I'm noticing during this conversation. There's over 10,000 people watching this right now as I'm looking at the live stream, and I'm also watching the comments. And there are so many amazing questions being asked. We can't get to all of them, but we have so many people from the GoldCare team in the comment section answering these questions. But I just want to relay to everybody that these are the types of conversations that happen every single day inside GoldCare. Inside our community, you can join thousands of other members, ask these same questions, and get the answers you're specifically looking for. For example, in the comment section right now, you probably see a name that says Daniel Jones. Daniel Jones works with GoldCare, and he is a wealth of knowledge around cancer and treating cancer, and he's giving some amazing answers in the chat right now. These types of things happen every single day right inside the GoldCare platform. All you have to do is go to goldcare.com/Dr. Gold, take you 30 seconds to sign up. It's no cost to you because Dr. Gold's covering your first month of membership, and then it's only $10 a month. So as we carry on this conversation tonight, I just want you to remember that all of this information and more is available inside GoldCare, and we can help you. We can absolutely help you, and you're seeing some of that and getting a taste of some of that tonight. Back to you, Dr. Gold.
We actually do these medical town halls because we want the American public and really people across the world to see that there's a better way, a different way to practice medicine, to take care of patients. And that includes diverse viewpoints, diverse backgrounds and information. And most importantly, that the person is not talked to, like an adult to a child, but as an equal, because nobody cares more about their health than the person who has the health crisis. But then the doctor can serve as an expert in that. And it has to be an equal kind of collaborative relationship. So that is everyone's vision at GoldCare, is to take care of you as an individual. We just do it differently like that. So just, I want to go back to, I think, Rick. So do you think, and I guess you can go there conspiratorially, like, again, cancer is not one disease, so it's hard to say like if there's a cure exactly, because it is so, there's so many different components to this. But based on your experience, like, is there some kind of cover up? Like, why is your experience unknown to me as a total insider in the medical space?
I can give you a quick example. I went back to the Mayo Clinic a year after my recovery. And I made an appointment with the surgeon that did the 8.5-hour operation on me. And when I walked through the door of his office, he went like this, because it's obvious, that I was much better. And I walked toward him to sit down in front of his desk, and he went like this. And I stopped. And he said, I want you to know, before we start, that nothing that has happened to you in Tijuana could have had anything to do with this apparent recovery that you have had. Now, I was flummoxed. I was a person that he should have cared about. And I stopped and I said, Doc, you look like a bright guy. But here's what I know now. You're not a healer. Otherwise, when I came through the door, you would have gone, crying out loud. Look at you. Look, I don't know what you did down there. I don't care what you did down there, but sit down. I'm going to take notes, and I'll look at this and see if there's something I can copy. Nope. Didn't want to know, and I turned around and walked out of the office. That's why you never heard about me. That's why we never talked, because our worlds have been separated on purpose.
So just to confirm for you, so this is what I saw during COVID was people would say, there was a young girl, she was 17. She volunteered to get the shot. She took care of kids. She was anyway, she ended up having 4 strokes. And the first thing the ER doctor said to her mother, the very first thing the ER doctor said to her mother, as they're wheeling in the girl who's completely paralyzed on her left side, right? Completely paralyzed. The first thing the ER doctor said was, it's not the shot. And I remember thinking, that is the opposite of how a doctor is trained to think. A doctor, for those of you who are not doctors who are listening, we are trained to go through something called a differential diagnosis. It is hammered into you from probably the first day of medical school. You're always taught to think of the 10 things this thing could be. If a patient has a headache, you're supposed to run in your head the 10 or 15 different things that could be the cause of the headache. It's called differential diagnosis. That is how we are trained. It is antithetical to all of our training to leap out of your body and say, it could not be this. And that's what revealed that it was kind of a religion. It was kind of a cult many of our doctors belong to. And it's very, very upsetting, because doctors can do a lot of good, but they can do a lot of harm with their, if they're not willing to listen. Have you experienced that, Dr. Murphy, in terms of, it's hard to be a physician when you're open-minded, because most of our peers were not open-minded.
Yeah, I have. And in fact, because I'm a little older, I did see older physicians who had intellectual curiosity when things were surprising to them, like Rick's case, and like the case of the stroke lady that you saw. But when you're in a cover-up, there will be no questions asked about these things. And so I do see this regularly. Physicians who say there's just no way anything outside of what we do could work. So they have closed their mind. They've closed, and basically are covering up any questions that would raise intellectual curiosity within them.
By the way, you happened to hint, and you didn't go down that road, but I'm just going to say something about the age of physicians. So it was it's very upsetting that young physicians are, in general, overall, in the aggregate, more closed-minded than older physicians. Part of it is just due to experience. You get a little humility, I suppose, with experience. You've seen enough times when you haven't been correct, perhaps. But also, young physicians are really being trained these days to be very, very, very robotic. And I'm exactly the right age where it started out more open-minded. But so in my med school and residency, because I was very young, I was 23 when I graduated medical school, wow. And it was still quite open-minded. Like in the 90s, it was still pretty open-minded. But by the 2000s, it was getting more closed-minded. By the 2010s, 20-teens, people were very, very, very closed-minded. It paralleled the government's pay structure, where you really were going down a checklist, like a protocol. You had to go down, you had to comply essentially with protocols to really get paid. And then, of course, the admission process to med school and residency, it's really changed. That's kind of what I'm saying, is that it's really changed. And I'm very pessimistic about young physicians, very, very pessimistic about young physicians. It's one of the reasons we seek people at GoldCare who are really kind of diverse, like from ages to specialties. So we're not prejudiced against young doctors, but the younger doctors will be exposed to older doctors, right? Anyway, I just wanted people to know that the medical education now really trains for people to be quite robotic. And I don't think I would go to a young American physician, quite frankly. Yeah.
No. Yeah, I quit teaching residents and med students about 14 years ago when I found that they were not at all listening to the pearls that I would bring forth every day. And I recognized that they were more interested in a flat screen device than they were in listening or even going in with the attending physician to examine the patient and take details of what the physical exam could reveal. So it's not what it once was for me. I did that for quite a number of years.
So I just want to kind of summarize a little bit what we were talking about, because a lot of people tuned in were very focused and interested on cancer, of course. So you start out by saying that you think the etiologies could be related to toxins, could be related to nutritional deficits, could be related to immune dysfunction. And in fact, Rick had this life experience where when he focused on B17, you were saying, I don't know if that's nutritional anyway, and also being very careful about, for example, gut health, things like that. He had a phenomenal response. He also noticed that his conventional doctors really didn't want to hear what he had to say. I just think all this is very interesting. We take a really, really different approach at GoldCare. So what do you think is the, what do you think, Rick, is there anything different you would say to your younger self for, like, you might just say good job that like you listened, or, it's such an unusual experience that you had.
Thank God. I mean, there were, if you really look at the story backwards, there were a couple of touchstones that I could have died on that hill 50 years ago easily. And the chemotherapist was the first one. When I said, what should I do? And he says to me with a wry grin, it is warm in Tijuana this time of year. In other words, he was signaling. He knew I wasn't going to make it. And yet he didn't think they were going to help me either. But if I want to lay on the beach and drink tequila, it's okay. The second one was my father-in-law. When my whole family turned against me because of this, and they weren't trying to kill me, they were trying to keep me from killing myself, leaving the Mayo Clinic. And when everyone said no, my father-in-law stood up and said, I like it. I'll take him and I'll pay for part of it. I went, deal. And then when Dr. Contreras said to me, I need your help. This is participatory medicine. I can't succeed without you. If you're not willing to do what we ask you to do, stay home, because it's not going to work. Man, I have never had anybody talk to me like that.
So interesting.
But it was, it rang true.
I want to share, for those of you who don't know, in addition to being a doctor, I'm also a lawyer, and I have a tremendous interest in like health policy for this reason. So I'm pretty familiar with how aggressive our government, both the federal FDA and also different state FDAs, have gone after doctors who offer different things that are, vitamins or different kinds of treatments. Our government has gone after people who are successful very hard. Brzezinski is a fellow that comes to mind. And so I know that that's true. It's well documented that that's true. And that is one of the reasons we don't work with the medical industrial complex, because we don't think they necessarily have the right motive in mind, the doctor-patient relationship and the patient's well-being. That's not to say sometimes you can't get good care, you can, but I don't think it's the primary goal of this system, whereas I know that is our primary goal. And Dr. Murphy, do you have any direct experience, like the way Rick did, about how the Mayo doctors wouldn't listen to him? Have you had any experiences like that as well?
I've had a number of physicians who'd say, you don't want to do that because it's going to be, you'll be considered a quack. It's quackery. or, my old colleagues, friends in gastroenterology and things were, oh, don't go that way. You're going to ruin your reputation. And but I'm much more interested, not in my reputation, but in what I can do to learn and help people and teach. And that's really the amazing thing about GoldCare is the education, Wellness U. If you haven't signed up already, you should.
Thank you so much. Yeah, no, that's right. That's what we want to do. You know what I love about GoldCare the most is that everybody really just wants to help other people, and that we're doing it in a pretty effective way, which is really we want to educate you. We actually want you to see doctors as little as possible. We want you to see them when you need them. We have things like we want you to have prescription packs at home for meds that we just think you should have in your medicine cabinet all the time. That was something that was super important to me after what I saw during COVID. There were so many choke points with the pharmacists. We're not going to go through that. I want you to be, armed, locked, and loaded, have what you need at home. So sometimes you do need physicians, but a lot of times we just want you to be educated, and that is our Wellness U. So, so for example, we sell for the least expensive price possible med packs, right, that have different antibiotics in them, or things with hydroxychloroquine and ivermectin, things like that. We think that that's really important. So we do want you to see doctors sometimes, but mostly we want you to just hear different voices and meet with people who have your best interests at heart. So I want to first of all, I want to thank both of you, because I think as a healer and as a person who's been through the system and came out the other side because you made your own decisions, and God bless your father-in-law, I want to thank you for sharing your direct experience with people, because I think a lot of people, first of all, I think a lot of people listening have had similar experiences. And part of what goes wrong is we gaslight people a little bit, like they're not seeing what they're seeing, and they are. And also, I want people to see that it's really quite balanced. I mean, we're not against any one thing or for any one thing. We're for open conversation, education, and just to invite you to a different way, which looks a lot like this. So, Dr. Murphy, are you seeing any of our GoldCare patients?
I've opened my schedule availability, and so yes, I will be in this week, end of the week, and I'm working to get more hours. But at this time, I am.
I just wanted to mention that, because a lot of people, once they get to know a person, hear a person, they definitely want to see a person. Now, Rick, you can't consult with our people because for people going to watch your testimony, they're going to be very inspired.
Well, when you talk about the price that people paid, I worked for John Richardson, but his father paved the way so that someone like me could get well. As you know, he was thrown in jail, had his medical license revoked, all because he treated thousands of patients like me, many of whom got better. And yet that wasn't part of the narrative. So I stand in their shadow every day. Without them, I couldn't have gotten well.
Yeah.
I'm so glad you mentioned that. I'm just so glad you mentioned that. So Dr. Richardson really paid a huge price. I've walked that same path, perhaps not as severely as he has, although my path has been very interesting. But there is a better way to proceed. But the fact that our government has been so aggressive towards doctors who step out of line, that for me is very revealing, that you need to have a place where you can talk honestly without fear of like the stepping out of line.
Right.
So, I don't normally say this really at the town halls, but why not? GoldCare is really outside the medical industrial complex system, because if you don't put yourself outside the system, then the system can come to threaten you, can come to throw you in jail, can come to take away doctors' licenses and things like that. And it's such a benefit and a blessing, because we can talk honestly and openly with members about any of their questions and any of their concerns.
Yeah.
We are filled with doctors who really just want to help people. That many of my doctors are people I've known now for years, because they fought back against the system wherever they were, whatever town they were in. Maybe they were in Kansas City, maybe they were in San Diego. You know, they just fought back and they said, I can't hurt people. A little bit like what Dr. Murphy was saying, like I'm less interested in what people say about my reputation than I'm actually helping a person. So I just want to thank you again. I don't know if you have a final thought, maybe Rick and then Dr. Murphy.
Well, thank you very much for having me on. And the fact that you're running an organization with a $10 membership. I mean, when I first heard that, I joined. I thought, there it is.
Thank you.
Right there. And yet, every time I've talked to anybody from your group, they've been top notch. So thank you for being here to be able to get people like me to the truth, because they don't know. And somebody had to tell them. Somebody did.
You know, thank you actually for mentioning the price. The reason, you know, we talked about this a lot at GoldCare, you know, how to price this and what is it exactly. We believe so strongly that every single person should come and join us, whether you have insurance, whether you don't have insurance, whether you're sick or whether you're healthy. Like, no matter what, we can help you, because we'll be able to talk to you honestly, but you have to be part of our system. That's why it's a subscription. Like, you have to be one of the family. And that's why we chose to price it very, very, very inexpensively. It's 1 or 2 cups of coffee, depending on the city you live in. It was a very intentional decision. We really want everyone to not live in fear. I was very frustrated that during COVID, people were so afraid that they were making very bad decisions. So I said, if I could ever be in a position where we can eliminate medical fear for people, I'm going to do it. And that's why we priced it very, very inexpensively, was to welcome everybody. There should be no reason not to join. And Dr. Murphy, any additional thoughts?
Well, kudos to you for putting together GoldCare. And I do know that this is the future of healthcare, because there's a crumbling aspect to the current convention-based medical system. And I think a lot of it has to do with protocols that are not thought, and they are not intelligently, they're just put together. So I think GoldCare will be how we all receive our care, at least the majority of us in the future, because it's not going to be as easy as it has been in the past to trust doctors. Doctors on GoldCare are able to say the truth and honestly express their opinions and give true medical advice. It's not protocol driven, but is actually intellect driven.
Right. And we heard from you tonight, just kind of a little taste, a little example of, there are lots of things doctors could tell you that are probably going to surprise you that you haven't heard. If a well-educated doctor who's motivated to help you probably has a lot of information that they could share. We want you to have access to that. I want to go back to, it's kind of like a modern, old-fashioned way of practicing medicine, where the patient is in the center. The patient is the patient is the priority. The patient is the only priority. So thank you both so much. I'd like to ask Drew to close us out.
What a fascinating discussion tonight. Thank you so much to Rick Hill, Dr. Murphy, and Dr. Gold for joining us. We know the conversation around cancer is a big and hard one to wrap our minds around. I hope tonight gave you some insight as to how GoldCare is approaching this disease, and that there are many alternative options around treatment. Our educational platform is full of accurate and uncensored information to help you answer your questions. And if you need to see a provider who can help you or a loved one with a cancer diagnosis, then GoldCare is the place to start that search. It's incredibly easy. Just visit goldcare.com/drgold and get your first month on us. Think of it like Netflix or Amazon Prime, but instead of a woke movie or free shipping, you're getting the gold standard educational subscription for all of your healthcare needs and access to doctors you can actually trust. A GoldCare subscription is exactly how you take charge of your personal preparation and citizen engagement in medical freedom. Put simply, you need to be a GoldCare member. It's the educational Maha golden ticket in your back pocket. Thank you for being with us tonight, and we'll see you at the next GoldCare Medical Town Hall. Good night.
Do you feel like the healthcare system is failing you? That's because it is, working exactly as intended to prioritize profits, bureaucracy, and big pharma, while leaving you and your family vulnerable when you need care the most. We understand your frustration. You've been asked to trust a system that feels rushed, impersonal, and biased. You deserve better. That's why we created GoldCare. Here, your values matter, your choices matter, and most importantly, you matter. GoldCare is more than a solution. It's a revolution. Trusted by over 10,000 members nationwide, we've built a system that puts your wellness first. With ethical, independent doctors who work for you, not the system, you'll have access to care that's transparent, trustworthy, and aligned with your values. We understand that stepping away from the familiar can feel daunting, but staying in a system that doesn't truly serve you is even harder. That's why GoldCare offers a healthcare alternative designed to work for you. Whether you're ready to step away from the system entirely or prefer to keep your insurance while seeking the transparent care, ethical doctors, and education you deserve, it's time to stop trusting a system that's failed you. Take control of your health with GoldCare. Join today for just $10 a month and become part of the healthcare revolution. GoldCare, built for you, powered by freedom, trusted by thousands.